I think that veterinarians and people in the vet community aren't good salesmen. And one thing I learned from my mentor, which I do, which I think is part of the reason my business has been successful, is because I can't sell anything either. Like, but if I've built a really good rapport with the client and then I really believe that something will help their dog, that sells it. It's the
That's exactly.
relationship and then the authenticity that this is totally going to work. You know what I mean?
No,
So
totally. And
I was thinking about that.
yeah, it's really hard. I mean, the beautiful thing is if they see results. But from my side, I got to get the machine in their hands for them to see results.
I know. Cindy, before we start, I had this idea I just like had been lazy about contacting you about it, but I had two cases that were really cool in that I diagnosed the dog on physical exam. I didn't have any imaging or diagnostics.
Hmm.
And then I treated them with almost shockwave only. And then after the treatment, or in this one case, 3/4 of the way through it, we did imaging. One was a musculoskeletal ultrasound, one was an MRI. And the level of damage in the body didn't match the level of clinical signs. The clinical signs were so mild and the level of damage in the body was so severe. And the only thing we did for these patients was shockwave.
Interesting.
It was like,
Are they going to get
I mean,
is
I know that the modality
well, yeah. Do you think the ultrasound one is going to get rechecked in a month or two or so afterwards?
probably not, because what happened was it was a biceps tendon injury. And you know how those heal really, really slow?
Hmm.
So basically I caught it like 6 days after the acute injury. And I like that 6th day, I was like, we're starting shockwave right now. Like, this is what we have to do. And I shockwaved him 5 times. And in my perspective, he was getting better right on schedule, but
Right.
the owner was feeling impatient. And she just said, I want to just make sure we're not missing anything. And I, no offense to me, that's fine. I'm not bothered by that. It's educational for me. Um, and I said, great. Yeah, let's get a musculoskeletal ultrasound to verify. And at this point, he was a grade 1 out of 5 lame, where he had been a 5 out of 5. And he went and got the ultrasound and he had a complete rupture of the biceps tendon. And the radiologist, who's a friend of mine, told me, she goes, this is the worst bicep tendon I've ever seen in 20 years. Yet he's grade 1 out of 5 lame after 5 shockwave treatments. I did treat him 10 times. I did go big on that guy because his mom was so committed. And now he has a slight head bob, maybe once every, I don't know, 5 minutes. He has no activity restrictions anymore. Like,
He's
yeah,
he's living a
no
good life.
medication. Oh yeah, I'm like extremely pleased. But what's so cool, Cindy, is that we usually get imaging at the beginning and not after we've treated them.
Mhm.
And because that was like, I did do some acupuncture and some manual work, but really the bulk of my treatments was shockwave. It really just is a testament that the dog should have been grade 5 out of 5 lame at like 7 weeks out. He just should have been, and he just was only grade 1.
That's cool. I love it.
I know.
It's
I
so
know.
fun. I
I've
know it
been
is.
meaning, yeah, I've been meaning to share that with you. And I have a second case that's a different body part and a different disease, but the same thing happened to me. And I'm just like, well, we should write these up, you know?
Yeah, I mean, even if they'd let you take a little video of, hey, here's his lameness and here's his MRI and this is all we've done and I, yeah, anything like that. It's cool.
Yeah.
Crazy. No, this is Dr. Wendy who runs all over Colorado with a piezo wave and a car full of equipment.
Thank you.
Um,
Yeah. Cindy got to ride with me. When was that, in the spring?
it was beautiful. In the spring, we were in the mountains.
Yeah.
Yeah. So she does great things. Great trick. I love your tricks because everybody gets kind of nervous when they have to work on a dog without a handler. But it's the reality of the world.
Yeah. I remember being nervous about that when I transitioned to working alone. And my good friends at Red Sage, they were doing work without techs, and I was like, "Are you sure it's gonna be okay? Like, are you sure it's okay, guys? Like, this seems crazy." But they're like, "No, no, no, it'll be totally fine because you're like not in a hospital setting, and the owners are usually really engaged." And I was nervous about it, but they were right. It's I don't need a tech. I'm fine. Hindatu, what's your rehab practice like?
So we basically actually just opened up a kind of ancillary, two doors down rehab center. So we have now a treadmill and we have our shockwave and we have our laser. So it's exciting to kind of be able to really finally have some of the space that we didn't have before to be able to do rehab. It's a general practice. So a lot of our work is really focusing on post-surgical patients and just, just your general arthritic old dogs, of which there are many, many, many to choose from. So yeah, so I honestly, to me, a big part of wanting to jump on this call is that I feel like the shockwave is still the tool that we haven't been able to really utilize to its fullest potential. When I first got my CCRP training, I was talking to them because at that time we didn't have the treadmill, and I talked to them and I said, if there's one, if I can't get a treadmill, what's the one other thing you think I should get? And they said shockwave. That was out in Tennessee, right? So, and I feel as though there's just, myself included, honestly, I think a lot, not quite a comfort in terms of even some of the placement, of the treatment, right? Like particularly for hips, I still struggle with where to use it on hips. Obviously, a stifle, all these, all these other sort of direct joints. It's kind of a much easier question to answer. And then I think the frequencies and all that is sort of trial and error and sort of experimentation, right? But I find that like I would love, in the way that we feel more comfortable with our laser, I'd like to feel more comfortable with when to use our shockwave.
What do you do for hips, Wendy? Because I know for hips we do a lot of the musculature around them.
Okay.
Yeah, so let's see. The way, and I think what you're asking, Hindatu, is like how do I like get the therapy source exactly where I need
Yeah.
to, so I'm going around the joint, because
Exactly.
you don't have direct palpation,
Exactly.
right? There's so much tissue.
Mm-hmm.
All right, so, and I'll front load this by saying I'm an assertive shock waver. So I give a really high dose of pulse number because and I only have the point therapy source. I don't have the linear. I want it, but I don't have it yet. And so your treatment area is like this big, right? And I understand that my palpation is really good. There's human error, right? Where I get distracted and look and it shifts, or the gel's slippery and I shift. And so even if I give, let's say, the medial aspect of the elbow 2,000 pulses, how many pulses are actually good pulses? That I don't really know, but I know there's some element of human error. So I go really big on every joint gets 4,000, and that's
4,000 shots.
And
wow.
I do a layered approach. So if I do a hip, let's say I'm working on a golden retriever he's medium sized but quite slim. So I do a 20 millimeter head and a 15. So this also makes up for the human error that occurs when you're trying to estimate the depth, right? Because we're really just visualizing, like, how deep is this based on the size of the animal, what's their fat content, what's their musculature, and so it's an educated guess. And so I don't want to miss the mark and like not shockwave anything that I should be. So I do this layered approach. Also, I think like our tissues aren't two-dimensional, right? We're not shockwaving a piece of paper at a table. So I like the layered approach. Even on like the stifle, where I am pretty darn confident, I still do, on most dogs, I do a 10 millimeter and a 5 millimeter. And so I'll split that. Not always 50-50. But let's go back to the hip. So first I do 4,000 pulses. And I split it. Let's say if I have that kind of lean or medium, like medium to large size golden who has some muscle mass, but he's not fat, I do a 15 and a 20 millimeter head. And what I do is I put my thumb or finger on the greater trochanter, and then I take the therapy source and I do a semicircle like this, and I fan, and I do a semicircle, and I also fan this way. So I'm.
So you end up getting both all around it. Yeah.
And the reason I keep my thumb or my pointer finger on the trochanter is that if I like slip way out of the zone, I know it, because I'll like hit my hand or I'll be way too far away. And what I've noticed in that is I get most of my biofeedback when I'm on that cranial aspect of that semicircle, pointing back in towards. So I'm never like straight. Here's the trochanter. I'm never like straight down. I'm always
Mhm.
a little bit and fanning, and now I'm like back a little bit. Can you picture
Mhm.
that?
Mhm.
And
Mhm.
then if I find, so let's say I want to do 2,000 pulses with that like semicircle technique. But when I come around to the cranial aspect of the joint line, I get some nice biofeedback. I might spend 1,200 of those pulses at that
Mm.
aspect
Mhm.
because I'm getting
Mhm.
my good biofeedback. So I'm like,
Mhm.
ooh, that's where I
Mhm.
need to be. Do you know what I mean?
Yeah. And your
Um,
biofeedback is maybe the animal's response, or, you know, basically you're like the animal's saying like, that's a little sensitive. And so would you then turn down your intensity and just stay there,
yeah,
or do you still
and
stay? Yeah.
it depends. It depends on who they are and what the intensity of the biofeedback is. If the dog's
Mhm.
like, whoa, then yeah,
Mhm.
I
Mhm.
turn it like maybe two, depending on what they do.
Mhm.
Sometimes if I'm not getting any biofeedback at all,
Mm.
I'll crank it up to, because I want to make sure, like, am I in the right spot, buddy? Like
Mhm.
I'm trying asking within
So you
reason,
said
right? Like,
you said you'll crank it up to what? I think you
well, it I I haven't found a reason to really go above 10, to be honest, although
okay.
that's just, I
Mhm.
kind of made that up. I bet we could go on
Yeah.
my own body. I've gone above 10 in a muscle belly.
Yeah, I don't think
But
I've
I
ever gone
feel
above
like when we're
6.
so, yeah, I try really hard to get to 6
Mhm.
because of Cindy, what
Mhm.
you taught me about certain
Mhm.
cellular changes that happen at 6.
Mhm. Mhm.
Um, but if I don't get
Okay.
to 6, that's fine. I just like
Yeah.
to. But sometimes,
Mhm.
like if I'm doing a hip, right? Like this is classic. You're doing the hip of a fat dog, right? And
Mhm.
you're like, I have the right zip code here, you know? And you're at like a level 6 because that's where you want to get.
Mhm.
And there's zero biofeedback.
Mhm.
What I might do is turn it up to an 8 and then rescan everything
Mhm.
and
Mhm.
make sure and try to get a little biofeedback just because it's confidence
Mhm.
building, right?
Mhm.
To know. uh, Now, if they have a huge reaction, I turn it back down. But if they have a reaction that's tolerable, just like with acupuncture, I'll ask them to tolerate
Mhm.
that.
Mhm.
It just sort of
Mhm.
depends.
Mhm.
Now, when I said like going up to 10, there's certain body parts I find that I can't really ever get to 10. The elbows, what pops to mind?
Mhm.
No way, they're too
Mhm.
sensitive. But the dog will tell you that, you
Mhm.
know, you
Mhm.
start at 10 anyway. But
Mhm.
sometimes with a hip that I've shockwaved, I'm on like the third or fifth of my series.
Mhm.
I can get up to 10.
Yeah.
Mm-hmm. And comfortably. Mm-hmm. I've done that. Mm-hmm. Yep.
And
Oh,
I'm
and
just
then let me,
curious. Oh, go ahead. Yeah.
I didn't want to leave this part out about the hip. So I would do, let's say, 2,000 around the hip joint
Mhm.
of the 20 millimeter head, another 2,000 of the 15. And then I'm going to take my 15 and I'm going to run it from the trochanter up to S1 along piriformis because that's where sciatic nerve is. And I'm going to
Hmm.
do about 1,000 up through that muscle belly.
Can you tell me those landmarks again?
Yeah, so I'll go from the trochanter up to S1
Mhm.
because that's where
Mhm.
piriformis lives, and sciatic runs right through that muscle belly of piriformis.
Mhm.
And
Mhm.
S1 is very close to the lumbosacral space, right?
Mhm.
And the
Mhm.
lumbosacral space is sensitive to higher intensity shockwave, and we could talk about that if you like. So what I'll do when I'm scanning that is I'll drop my finger into LS to make sure I don't go
Mhm.
into LF at that
Okay.
higher intensity.
Okay.
Do you know what I
Okay.
mean? I'm kind of
Mhm.
blocking
Mhm.
myself. Yeah. And I put a little pressure into it. Do you do that too?
Not probably a ton, you know? I think I probably end up doing more so in the hip because I'm just not sure if I'm, making out of contact. But yeah, probably not super
Yeah,
pressure.
sometimes I'll like if I'm looking for feedback and I'm not getting it,
Mhm.
I'll just deep my pressure and lighten it and see if that makes a difference.
Mhm.
I don't know
Mhm.
how much you shockwave your own body, but sometimes the pressure for me makes a difference where
Mhm.
it feels
Mhm.
more intense with my which I feel like is a good thing. I want as much like physiologic change as I can tolerate. So
Mhm.
that's
Mhm.
another thing a little bit.
And
Um,
what about the hip
there were
flexors? That's a question I have because I
mm,
do that a
mm,
lot with the hips.
That's a great thing, Cindy. And I think if I have enough time, I will add in muscular tissue. So because I'm an assertive shock waver and I do a lot of pulses, I prioritize my joint, and then if I have time, I will run up, sartorius tensor fasciae lata up into that hip flexor region for sure. Um, and then I honestly, for pace, I usually just keep whatever head I have on. to scan those muscles.
Mhm.
Yeah.
Yeah.
I have, oh, sorry. I just have two
I don't know if
questions.
you've noticed this. Yeah, I don't know if you've noticed this, but to get dogs to tolerate the shockwave, I've noticed if I do the deeper head first, they do better,
Okay.
which
I have
is
not noticed
counter.
that.
And I noticed it in myself when I first got the unit and was shockwaving my body all over the place to see what it felt like. I did notice that the deeper head was less tender.
Hmm.
And you did mention that, sort of for example, for the hip, you would do the kind of the semicircle. You would do one semicircle with a 20 and one with a 15 generally, or you do, yeah? Okay. Okay. I had a question just about, especially for you as doing mobile, part of what is there's always, in the discussion of shockwave, there's always this discussion of the contraindications of it being, sort of some sort of cancerous lesion. Do you routinely do imaging before you do it, or do you, kind of what's your discussion of that? Because that, I guess I'm just not sure, again, because I'm not comfortable with it. Is that just really a very academic, like we have to say this, but it's not really a concern, or is this really, it's a real concern that we should be, because I mean, because it does become a little bit limiting if the requirement to doing shockwave is having some imaging beforehand, whether that be an X-ray or something like that, So can you just talk about that a little bit?
Yeah, great question. And I'm a house call doctor, so I don't
Yeah,
have available
right,
diagnostics unless for back, right? So I
right.
have to be compelled to wait on therapy for diagnostics. And
Yeah.
for me, like this is my opinion and my the way I practice is for me, I don't need diagnostics.
Mhm.
I don't really feel like there's a ton of contraindication with our shockwave. I
Mhm.
suppose, I mean, some of the limitations I think about where I do look at imaging is if there's metal implants. I
Mhm.
just want to
Mhm.
understand where they are with
Mhm.
shockwave
Mhm.
because we know they won't go through.
Mhm.
Um, I feel like I haven't ever been caught where I ended up shockwaving something that turned out to be a neoplastic process. That
Okay.
hasn't happened to me. Like bad arthritis has somehow developed osteosarc near that joint.
Or that it was
That would be pretty
misdiagnosed.
unlikely.
Yeah, I mean, I guess that's a worry too, especially if I start to open up the ability to have people refer cases to me. Right now, we'd just be trying to use this for our patients, but eventually, if the rehab service gets popular enough, which we certainly hope it will, be a place where people can send animals to. And so, that's always a little tricky. Like, if someone sends something for one thing and it ends up being something else. But yeah, I'm
So,
just curious about that.
Yeah.
in terms of contraindications, so we as a company list contraindications.
Mhm.
There's five or
Mhm.
six of them, and obviously, cancer and neoplastic lesions is one because we don't know. That is just
Mhm.
we do not know.
Mhm.
We have angiogenesis, and it's a
Mhm.
cover your ass situation.
Mhm.
Um,
Mhm.
but all of the contraindications, when I send you the little magic book that I spent a year working with, um, one thing is it absolutely has to be in the focal zone.
Mhm.
And two, most of these, well, they've all been made contraindications from using quite high energy. Now, your
Mm.
therapy source only goes to zero point 0.4 millijoules per millimeter squared.
Mhm.
And, some people say, well, then you don't have enough energy. But the reality is, for the contraindications that were done years ago, they came out from lithotripsy and they were close to 0.6 or 8
Mhm.
millijoules, and you
Mhm.
do not have
Okay.
that much energy. Do you have
Okay.
enough energy to heal bone? And that always becomes this big talking point, and you do, because that
Mhm.
happens at 0.15 to zero point 0.2 without any problem.
Mhm. Mhm.
So that's the other discussion that we had back a while ago was like, when this came up with, I think it was Andy Looney, and
Mhm.
you guys, if it's a bilateral lameness, you can
Mhm.
pretty much, in
Mhm.
a senior dog, you're
Mhm.
not going to be suspicious of osteosarc, right? But I consider all of our contraindications, especially like your senior dog population, um,
Mhm.
as discussion points.
Yeah.
They're
Yeah.
points that if they're a possibility, there's something that should be discussed with the client. Is that?
Yeah. Yeah, that's really helpful, and I think it helps, because there will be some clients that will want to get that information, and others that won't necessarily, and that's that's fine. And That's super helpful. Can I ask actually another um, for Dr. Wendy? I don't know how to say your last name, so I call you Dr. Wendy.
Um, yeah, it's yeah. Don't worry, just call me Wendy. That's better.
Wendy. Okay, Wendy. So Wendy, so when you talked about, 'cause I've never really used it on muscle actually. When you talked about it, I have this one case of gracilis muscle contracture, and I'm curious if you think that would be a potential, you know, indicator for it too, for using the shockwave. I've just mostly been focused on just like, you know, like I said, more bony specifically lesions, like chronic arthritis and that sort of thing. But I'm curious if you ever use it on anything like that, where you just have just like some tight, painful muscles.
Yeah, so I do use it in soft tissues, so
Hmm.
tendon, ligament, muscle. And is your gracilis contracture like already fibrosed down, like no elasticity left in the tissue, like
Yeah,
it's kind of end
this is a dog that's so painful that I can't even really palpate it without sedation, right? Yeah.
So I have a couple three things to share with you. So
Hmm.
full transparency, I haven't treated a contracture with it. I
Hmm.
haven't seen a contracture since
Hmm.
I've gotten to you. So I don't feel like they're that common. So
Yeah.
my thought is with your story though, if there's a painful element,
Hmm.
then there's gotta be still some like what I would call like live tissue in there that could
Mm-hmm.
potentially be saved.
Hmm.
That's my gut feel. I have no studies behind that statement
Sure.
in Datu, but I wonder if it would be I am confident that it wouldn't hurt the tissue.
Yeah. Okay.
When I was early on in my shockwave, when I had a case that I was like, I don't know if this is going to work, but I really want to try it,
Hmm. Hmm.
I would strike a deal with the owner. I've done this twice where I said, hey, I think there's a potential that the shockwave could really help, but I don't know for sure. So will you be, but it won't hurt.
Hmm.
Will you be my guinea if I give you a deep, deep discount?
Hmm.
And
Hmm.
the answer is always,
Yeah.
and then
Yeah.
I get to learn.
Yeah.
So this might be a case like that,
Yeah.
where
Okay.
you either do it at like a minimal charge or what you would consider cost to you,
Hmm. Hmm.
just to learn about it. When we're doing muscle tissue that isn't contracted but has other disease that has like a muscle strain,
Hmm. Hmm.
I think classic iliopsoas,
Hmm.
right?
Hmm.
Um, iliopsoas strains is one of the reasons I bought the unit because I
Oh.
feel our traditional therapies are lukewarm, in my opinion,
Mm.
at handling that. And the shockwave is the primary therapy for a muscle strain.
Mm.
And I say that like I feel so confident about that that when I see a psoas for the first time, I say we do need to do shockwave today,
Mm.
right now.
Hmm.
And earlier you shockwave that, the better. And I have really great outcomes with psoas and shockwave.
That's awesome. Yeah.
Um, yeah, and I would say the same for shoulder tendinopathies,
Hmm.
which is the other big soft tissue that I don't wait at all. And it's, I when I tell owners the kind of the treatment plan, what I offer is what I call traditional rehab plus shockwave.
Hmm.
So
Hmm.
traditional rehab, your exercise
Hmm.
therapy,
Hmm.
your acupuncture, therapy, your laser, all that stuff, right? That's like your traditional,
Hmm.
this is how I phrase. And then your shockwave therapy, because for me, I sell that kind of a la carte. And there's very few times, not very few, but as I've gotten more comfortable with the shockwave, there's sometimes when people say to me, hey, Wendy, I don't have the budget to do both at the same time.
Hmm. Hmm.
So which should we start with, the traditional therapy or the
Hmm.
shockwave?
Hmm.
And the conditions where I say, we got to prioritize the shockwave. Shoulder tendinopathies, iliopsoas, those are off the top of my head. Those are the two biggies where I like drop everything and like we have to do our shockwave right away. And I'll even wait on all the other stuff if I
Hmm.
have to. I mean, I don't
Hmm.
like I prioritize that. As far as the muscle contracture, I want to see Cindy and you talking to all the vets out there. What have you heard about contracture?
So there is some email chains that go around about the muscle contracture issues. And what I can do is set you up with Dr. Struble in where is she? She's in the San Francisco area. And for
Okay.
her, one of the reasons she bought the machine was for contractures.
Okay.
She does have to use fairly high energy. Um, the other thing she says is in her emails that I see is, don't give up. It can take 12 weeks and 12 treatments.
Wow.
Um, and for me, the biggest question is your customer or your client. If they're not going to do any stretching or any at home work, any homework, that's it really, those muscle contractures take homework. You can't just,
Yeah.
shockwave them, and you can't see them once a week and do the stretching and the mobility on them and expect them to hold for a whole week.
Yeah, no, all not great. So, but yeah, but I actually, you know, what's funny because I was thinking about, especially since we had just tried the treadmill start, I actually was thinking about offering her to use it for free just for learning purposes for us, truthfully, and getting comfortable. So why not throw a shockwave in there too, if the dog will let us. Wendy, you mentioned something too earlier about laser. Do you use typically both in the same, like, will you sometimes use both a laser and a shockwave? Because in my mind, it's kind of an either or, but I don't know if, that doesn't necessarily seem accurate, right?
Yeah, I definitely piggyback those, even in the same
Mhm.
session.
In the same session, okay.
And
Oh.
yep, and I'm not saying this because Cindy is sitting here at all, but to me, the power of healing of the shockwave is like 1,000-fold over the laser.
Yeah, wow.
And I know laser people who are in that business would disagree
Mhm.
with me, so
Sure.
you can
Yeah.
take my as however you want it, but I just feel like, to me, I use laser as more of an adjunctive, where I would never
Mhm.
have a dog only laser, but when I have time in a regular visit, I love to add it. And I do a lot
Ah.
of raising for home use where dogs can
Mhm.
get lasered every day. So I love that. Um, but the I think people think of the laser, at least our clients, as the laser and the shockwave is similar because they have the same look. They have a box with a cord and a unit, right? And a hand thing.
Mhm, mhm.
And my clients will ask me all the time, "Oh, are they really similar?" I'm like, "God, they're really, really different.
Yeah.
They're
I think
really
of them
different."
as being similar in terms of the outcomes, definitely the way they achieve them are different, but I never, yeah, it's really cool to think about, um, and actually just even saying it out loud. It's like, yeah, if they are trying to do the same thing but do it differently, then that's great. That's multimodal therapy, right? That's actually, a good way to look at it. Um, that's
Can you
really
guys hear
helpful.
me?
Yeah.
Yeah.
Mhm.
Just want to chime in. Hi, Wendy. It's Terry. I wanted to just mention that we've had a couple of gracilis issues, and a lot of times we will, we shockwave the heck out of them, but biologics and injections are very important. And
Mm,
then while they're
mhm,
sedated, we will follow up with um, heavy shockwave and deep stretching
mhm.
and deep massage.
Yeah. Mhm.
And then sometimes in between those sessions, we'll do therapeutic ultrasound.
Yeah, we don't have one of those, but that definitely seems like it'd be so great for something like that. But that's interesting. What biologics do you use?
PRP, stem cell,
Okay. Okay.
HA,
Mhm.
um, and it's usually working dogs, like, right? It's usually the police dogs
Mhm.
that are,
Mhm.
they need
Mhm.
to like be functioning. So
Yeah.
they're not
Yeah.
ones that are going to take the sideline. They're not ones that are going to be like, hey, great,
Mhm.
rest your dog. Like, they got to get back to work
Mhm.
tomorrow. So,
Yeah.
but we've
Yeah.
had really good outcomes with them. And one dog in particular was a trauma. She was actually a chocolate lab. And this dog
Mhm.
is
Mhm.
fully functioning now. And we did one injection with her. So,
Wow. Where are you
yeah,
putting it?
yeah, right into the muscle belly.
Wow, that's amazing. Okay, that's so cool. That's so cool. Thank you for sharing that.
Yeah, yeah.
This is a really good medical thing, but it's also really lovely for keeping your business going with shockwave,
Mhm.
since it's kind of new
Mhm.
to get like really using it a ton. So dogs that and you have a lot of arthritic population, right? And
Mhm.
so
Mhm.
dogs that have arthritis or are going to get it.
Mhm.
I think talking to your owners about shockwaving, doing a series, even if they're doing well, every six
Mhm.
to 12 months. And I really like the 6 months.
Mm.
And I talked to owners about it being an insurance policy that even if they're doing well, we're just keeping that cartilage health as
Mhm.
good as it can be. And
Mhm.
although we'll never know what we gained because they're
Mhm.
doing well, we
Yeah.
wouldn't want to test it and see, but we know behind the science, it tells us that all that cartilage is getting supported with our
Mhm.
shockwave. And so I think financially budgeting 3 sessions once or twice a year for most people, if they
Mhm.
plan to take
Mhm.
that, um, And then a new thing I've been doing in the last 6 months is these end stage cases that I have, because most of the literature talks about doing like a series of shockwave and human studies. Sometimes they're like 20 sessions. I think most of us vets do like 3 to 5, although I have gone as high as 10. I'll do a series as I normally do it. Let's say an end stage dog, I'll do a series of 5, 1 to 14 days apart. And then we do what I call ongoing shockwave. I think up at Red Sage, you guys call it palliative. But it's basically these kiddos that they really benefit from getting shockwave, whether it's once a week or every other week or once a month, but it is ongoing. And I've had success with that. He's like, I've had an end stage elbow guy that really needed that. I have an LS guy that needs that. And it'll keep your business going, of course, but it is medically relevant and important, I think, for the modality to really show what it can do.
I like
so
the
basically
way,
you'll do your series, your initial series, and then after that you'll just, it's kind of similar to like your Atacon, like I'm doing my series and I'm just doing it kind of as needed. Okay.
Yeah.
Or no, you're talking about more regular sessions though. Okay.
Yeah, more ongoing. And I definitely talk to people about the delayed onset of clinical sign improvement that you can get with shockwave, because I want to make sure shockwave gets the credit, because sometimes it's a very like slow improvement and we forget to look back and say like, where were we a month ago?
Yeah.
And so I always make sure I have notes. But I encourage the owner, I say, look, that's one of the things I say, that's one of the downsides of the modality is we have to wait a little bit. Because I don't want to feel like, oh, it didn't work, we're a week out. I don't, because we're not expecting. But yeah, and I have used it where I have a setback. I use it in cervical pain a lot with a lot of success. And if I have a setback, and we're not due for a series, I'll do it early.
Okay. Yeah, that's awesome.
and some people do a special pricing for those geriatric senior,
Yeah. I do 20% if you commit to ongoing, which is once a month or more, then you get that because you're committing too long. And I mean, I just made that up.
Yeah. That's how so much of this is going to be done, right? Like it's a lot of it's like that's why I think the more the sooner we can get doing it more often, the more we'll figure out what works for us, right? It's hard to know that if you're doing it.
Don't be shy. That's very a key to getting confidence in it. The other key I think is stopping in the middle of a session and moving the joint or feeling the muscle or whatever. That gives you a lot of confidence that you're actually doing something.
Yeah.
Because sometimes you're like, oh, they're not reacting, and am I in the right place? Is something happening? And I'll be like, oh, it feels different. Duh, I
feels
have
better, right? Yeah.
I use it all the time. I'm hiring a tech just to do my shockwave for me because I can't keep up with it.
So you are, huh? You're doing it? You're gonna get a second person working for you?
I am. Yeah, well, my brick and mortar place opens on Monday.
On Monday?
So, yeah, on Monday. I know, isn't that crazy? I'm so pumped. And I've actually hired a friend of mine who's terrific. And she, my vision for her role is to basically run the shockwave program. And, once she's dialed out on that, I have a zillion other things I can teach her to do, of course, that we're going to start there because I'm so full, Cindy, like I can't, when I have like a shockwave that I need to do right away, and I'm trying to make a 60-minute into a 90-minute visit, it's just things get pushed out, and then my dogs aren't getting their every 6 months. And I can do better. So I just need a little bit of help. And she's super part-time, which is kind of what I need right now. Cause I do like hiring something and having a new building at the same time is kind of a lot. So it's working out great.
And then we're going to do a piezo wave wet lab for everybody in the area. There you go.
Nice. Oh, that's cool. That's a great idea.
I'm always looking for places to do those.
You know what, Cindy? I would love to do that because with this shockwave, the way I'm going to use it with my technician, I'm going to do a little referral practice. And I have 2 GPs who I want to rope in, and I've already talked to. And these are like GPs that I really trust with making a good diagnosis. So I don't end up with like a dog coming in for elbow shockwave who actually needs cervical. Do you know what I mean?
Right. Yeah.
So these are really good doctors, but not rehab doctors, but to see some demos, that would be so great. Oh, and then I also have like one rehab. Yeah. so that anyway, the wet lab demo sounds awesome. And there's a bunch of people like Karen Fine has a unit. She's around the corner for me. Caitlin Leonard, I actually shockwave her patients for her. She'll refer into me just for shockwave and then I put them back. So we have a nice relationship. So there's a bunch of us right here that would be awesome for. And I'm happy to host.
Yeah, that would be fun. Yeah, just send me an because we did a trial at Deb Taraka's. We charged a moderate amount so that people are committed. And then what we did at Deb's was she donated her own time and her own staff, which isn't necessary. But then we took all the extra funds and gave it to the police dogs because it wasn't meant to make money. So, it's meant more for the people to have a commitment of coming. I think it was $109. And we had 8 people or something. And, her staff and her time was donated because that's the way she wanted to do it. And then we, split up whatever was left, and, took care of everything that needed to be taken care of, which is basically food. And we got everybody box lunches, and we made it like from 10 to 1. So people on a Saturday, so they could drive in, so they didn't have to, come the day before or anything like that. Like she's more spread out than Denver, in Colchester, Connecticut. But we had people come from 2 and 3 hours to drive in for the day.
Awesome.
I mean, there's so many people in this area. I mean, I think, yeah, people would, I mean, it'd just be Denver would be enough.
Yeah,
But
yeah.
yeah, we should do it. Let's do it this winter or whenever. I need to get settled in first.
Get
so
settled
probably
in.
not till a little while, but yeah, I'd love to host that. That'd be great.
Well, Dr. Wendy, I thank you for coming on and helping us.
Thanks, guys.
Thank you.
Okay,
Appreciate it.
thanks.
Bye-bye.
Bye.